The walls of the axilla. We have the anterior wall. And you know the anterior wall, there are two layers. The superficial layer is the pectoralis major muscle, which is inserted into the lateral lip of the bicipital groove. It has two heads, clavicular and sternocostal head. In the practical exam, we put a pointer or attach it by a colored thread and say, identify the attached structure. So this is pectoralis major muscle. Name its two heads. It has clavicular head and sternocostal head. Nerve supply, because it is major, supplies by two nerves, medial and lateral pectoral nerve. So this is the pectoralis major muscle. And you know, it covers all the axilla. The axilla is not clear because it is the anterior wall of the axilla. Deep to it, I'll find the pectoralis minor muscle, which arises from ribs 3, 4, and 5 to be attached into the coracoid process. It's supplied by the medial pectoral nerve. And you can remember pectoralis minor, medial pectoral nerve. The subclavius muscle is not clear here, but this is maybe part of it. The subclavius muscle. This is the muscles of the anterior wall. The medial wall, there is the upper four intercostal spaces with the serratus anterior muscle. And this is the serratus anterior muscle. It is inserted into the anterior surface of the medial border of the scapula. Serratus anterior muscle. You should not miss it. This is the subscapularis muscle. If I see the subscapularis muscle, so the muscle on the medial border is the serratus anterior muscle. Serratus anterior muscle, which is supplied by nerve to serratus anterior from cervical 5, 6, and 7. It laterally rotates the scapula. Serratus anterior muscle, very important muscle. If it is injured, winging of the scapula will occur. So this forms the medial wall. The posterior wall, there are three muscles. The subscapularis muscle, it arises from the subscapular fossa. So this is the subscapularis muscle. It can be pointed at the practical exam. Identify the muscle, subscapularis muscle. And then the teres major muscle, which arises from a lateral border of the scapula, the lower third, the lateral border, and the dorsum of the angle, inferior angle. This is the teres major muscle. And the other muscle which is inserted into the floor, this is the latissimus dorsi muscle. Latissimus dorsi muscle. So you have to differentiate between latissimus dorsi muscle and teres major muscle and the pectoralis major muscle. Because sometimes this part of latissimus is large, resembles that of pectoralis major muscle. This is a common mistake in the practical exam. So if I point to this one, this is the latissimus dorsi muscle. I see all the blood vessels and the nerves and the axilla because it is inserted into the floor of the bicipital groove. But when I point this one, it will cover the axilla completely. So this is pectoralis major muscle forming the anterior wall. And this is latissimus dorsi, usually cut like that. And it has a long tendon to identify it. But this is the teres major. It is attached to the scapula. And it is inserted into the medial lip of the bicipital groove. So we have not to miss that this is the serratus anterior muscle. This is the subscapularis muscle. And this is the teres major muscle. And this is the latissimus dorsi muscle. العضلة بتاعت الحرمية. latissimus dorsi muscle. Always the student have a mistake between the pectoralis major muscle and latissimus dorsi muscle. It's a common mistake. So you have to know this is pectoralis muscle forming the anterior wall of the axilla. It covers the axilla completely. But here, to identify this, the axilla is open, the blood vessels is seen, and everything is seen. And it's cut also, and long tendon. The teres major muscle is attached to the lateral border of the scapula. So it cannot be in the exam B to be cut like that one. No, it should be have its origin from lateral border to its insertion. So this muscle should be complete in the practical exam. But this muscle should be cut in the practical exam. And this is the subscapularis muscle from subscapular fossa to be inserted into the lesser tuberosity of the humerus. And don't forget for the serratus anterior muscle. And if you can see that most of the fiber, 5/8 of its fibers are inserted into the inferior angle of the scapula. If you can see this, this is the thickest part of the muscle. 5 أثمان المصل inserted في inferior angle هنا. ليه؟ عشان it can rotate the scapula laterally so that I can raise my hand above 90 degrees. Serratus anterior muscle. This is by far the commonest muscles in the practical concerning the axilla. The pectoralis major muscle, pectoralis minor muscle, the subclavius muscle, the posterior wall, subscapularis muscle, teres major muscle, latissimus dorsi muscle, the medial wall, the serratus anterior muscle. So these are the most important points in the practical exam concerning the muscles or the wall of the axilla. شكراً.